So the first PT we would do for this adhesive capsulitis, I think, would be ultrasound. Now when we do this, since the capsule itself is a deep structure, we're going to get right there on the joint, and we're going to use 1 megahertz because this is a deep structure, and so the less megahertz it is, the deeper the structure will go. And first thing we're going to do, we're going to get some emollient we're going to put on there to get that to conduct heat. We're going to turn it on, push to 1 megahertz, and then for this, the duty cycle, we're going to do 100% because this has been a chronic injury. And so what it means when there's 100% duty cycle is that we will have heat, which this heat can do many things. It will increase the blood flow, and this will cause dilations of blood vessels, which will cause more blood to come into the area and speed up healing. And it will also increase nerve conduction velocity, meaning the nerves, everything will travel faster on the nerves. And then this will heat up the tissue, which can cause the decrease in the pain in the patient. So when we do this, we're going to want to do it, roughly 10 to 12 minutes or so. And we just need to keep asking the patient if that's okay, if they can tolerate the heat, if it's too much, if it's not too much, or whatever. Once we're done, we will wipe off the emollient, and we could do this with the patient every time if it helps him. Like I said, it will decrease the pain, increase the blood flow, which hopefully will heal the injury and help the moving process of the injury. Second on this, you could do such thing once the patient has actual range of motion, once you do mobility in the patient and everything like that, you could start doing external and internal rotations with the resisted band. So here I will have the patient stand up, please. Okay, I'm going to wrap this around your hand, and you could do sets of 2 or 3 sets of 8 to 10 on this, 2 or 3 times a day. And I'm going to have you go and just rotate your shoulder out as far as you can, keeping your arm straight. There you go. And again, you will do this once you have range of motion after probably many visits just due to adhesive capsulitis. I'll have you do it 4 or 5 more times. Okay, there's your resisted external, and this will also strengthen those muscles around there to help the shoulder become stronger as well. All right, then I'll have you come in towards your stomach, do the same thing. And again, you'll do 10 to 12 reps of that 2 times a day. And this, you'll be strengthening subscapularis with external. You'll be doing teres minor and infraspinatus on that. And this will just, again, strengthen everything. So when your shoulder gets back to normal, it'll be a lot stronger.